Welcome back to Marketplace. This segment is sponsored by American Association of Endodontists. Now, more than 5 million teeth are knocked out every year, but only 9% of adults in the U.S. know what to do when it happens. So Dr. Stephen Zweig, president of American Association of Endodontists, joined the show to help with solutions. First question for you, doctor. Why is oral health care so important?
Oral health is very important because it definitely has an effect on your overall health. And this can happen on many different levels. The first is that we know that when people meet you, the first thing they see is your smile. And if your smile is not good, it will reflect poorly on you, and it can affect your social interaction with other people and affect your job. Secondly, when you have bad oral health and broken teeth, it's going to affect the way you eat and chew, and that's going to affect your nutrition, which will definitely have an effect on your overall health. And lastly, we're finding through research now there are connections between your oral health and your overall health in terms of other systemic diseases such as diabetes, heart disease, and even oral cancer. So your oral health definitely has an effect on your overall health, and so it's very, very important to maintain your oral health.
And now, what should someone do if their tooth does, in fact, get knocked out?
So if your tooth, unfortunately, we're seeing a lot of teeth being knocked out through bicycle, scooter, and also sports accidents. So the first thing to realize is that time is of the essence, and replacing the tooth into your mouth as soon as possible is the best thing you can do in order to save your tooth. The first thing you need to do is find your tooth. So you're going to want to pick it up carefully by the crown of the tooth and be careful not to touch the root of the tooth. Secondly, you want to make sure the tooth is clean. And the way you're going to do that is by rinsing it with either water or milk. And then lastly, you want to replace the tooth into the socket from where it came. And so after that, you're definitely going to want to see a dentist to make sure that you've done that properly. And many of these teeth actually end up needing root canals, so you're probably going to want to see an endodontist who's actually a specialist in doing root canal.
Okay. And how is poor oral health linked to other health issues?
Well, we don't know the exact cause of why oral health is connected to these other systemic diseases. But what we do know is that there is some, that most oral health issues are related to bacteria. Cavities and are actually a bacterial process. So bacteria can enter from the oral cavity into the body, and this can affect overall health. So we know that there's a connection between the bacteria from the oral cavity to the systemic to your body.
Never have